Hello, my name is Olivia, and I'm a student nurse at Montgomery County Community College. And in this video, I'm going to teach my client how to administer erythromycin eye ointment. This erythromycin is used for when patients have conjunctivitis, and our patient does have conjunctivitis. And so I'm going to teach him how to apply it safely. I have some patient outcomes and interventions I first want to go over before we meet the client. Once we meet the client, I'm going to teach him how to apply his eye ointment, and then lastly come back here and reflect on the intervention and the teaching method. So let's go ahead and get started. I will first mention my 3 outcomes I want the patient to have. So here we have the client will be able to demonstrate his understanding of safe medication administration when asked to reinstate the steps of applying eye ointment, and know when to call the provider and the expected effects and adverse effects of the medication upon discharge. The second is the client will confidently and safely administer eye ointment using the correct procedure upon discharge. And lastly, the client will state that he is confident and comfortable applying his eye ointment upon discharge. Okay, so we have our client outcomes, and now let's discuss the interventions. So here I'm going to teach the client how to safely administer his medication when he's at home. So first I would start off by letting him know that hand hygiene is really important when you're applying eye ointment to your eye, especially because, well, first of all, he has that bacterial infection. If you have unwashed hands touching your eye, it's going to get worse. The proper way to administer that medication is first to wash your hands, wash your face, and then you want to assess the eye, look in if there's any discharge or any type of crust. You want to take a tissue or a washcloth with warm water and go from the inner corner to the outer corner and clean that out. That way when you apply the medication is going straight into the conjunctival sac and there's nothing blocking it. Okay, and then I would teach them to take off the cap, and we want to be sterile. So here we're putting the cap on its side, not on top of the table, because you want it to stay sterile. You don't want the applicator to get infected. So once you have that applicator open, you want to use your non-dominant hand, pull down on the conjunctival sac, and you want to go from the inner corner to the mid part. And then when you get to that mid part, you want to twist the applicator. That way it will stop administering the medication. And then you want to slowly close your eyes for 1 to 2 minutes. And then when you open your eyes are going to be blurry, but that's to be expected. And that will disappear in 5 minutes. After you're done that, you can put the cap back on. You can store that medication in room temperature and tightly closed, light-resistant containers. So I'm just going to let him know to put that in his medicine cabinet in his bathroom. And then after you've done all that, you want to rewash the hands and don't touch the eye anymore to practice safe, clean technique. And you don't want to add more bacteria into that eye. And it's essential to track applying the medication. Since it's an antibiotic, you want to use it to its full completion. Sometimes the provider will say for 5 days, 7 days, 14 days, you want to make sure you complete it to its full capacity. And also notify the provider if the condition worsens or if there's no improvement. That's when you would notify the provider. So let's go ahead, let's use these interventions, and then once we're done with the interventions, we're going to make sure that he completes those outcomes that I have for him, and then we'll go ahead and make that evaluation. So let's go ahead, let's meet the client, and let's get going.
Hello, Mr. Calvo. I'm Olivia. I'm a student nurse at Montgomery County Community College. How are you doing today?
Okay.
Okay. And can you verify your name and date of birth with me?
Raul Calvo, 8/27/1956.
Okay. And let me just see your name tag here. Okay, very good. Okay, so I'm here to show you how to administer your eye ointment today. So on the chart here it says you have conjunctivitis in your right eye. Is that correct?
Yes.
Okay, so with this drug, it's erythromycin. It's an antibiotic. So before we put this in, you need to first wash your hands, and you want to wash your face.
Yeah, I washed my hand and my face before I came over.
Okay, good. All right, so after that, you want to assess your eye. You want to look to see if there's any discharge or any crust in your eye. And if so, you want to take like a hand tissue, and you want to go from the inner corner and then out to the outer corner, just very gently, just to remove all that. And then this is like the tube it comes in. So you would take off the cap here, and then you want to place the cap on a table, and you want to place it on its side, not like on top, because we want to keep that applicator sterile. So, and then you want to take your non-dominant hand and pull down your eyelid, and then you want to put it like in that that lower lid, from the inner corner to the mid part of your eye, because he said like half an inch. And then when you get to that middle part of your eye, you want to twist it so then it like ends the ointment. And then you want to slowly close your eye, keep it closed for 1 to 2 minutes, and then you're going to see that your eye's a little blurry, but that's to be expected, so no harm there.
Okay.
All right, and then you have your mirror there.
Yes, I brought in my mirror.
Okay.
That you gave me.
So let's take off your glasses. Okay, and then I'll give you this. So let's take off the cap, and then you can just put it on this table here, and put it on its side. Okay. All right. So in the mirror, I can hold the mirror for you because you need that other hand. Okay. So yep.
So they can see me. I'll put it here.
Okay, from the inner corner to the middle. Okay, and then twist it at the end. Okay, close your eyes. Alright, yeah, so it might be a little blurry, but don't worry, that'll go away. It is because it's a thicker cream. Alright, and then you want to fully close the cap, and then you want to wash your hands immediately because this has medicine in it. And then you want to store it in a closed space, like in your medicine cabinet. And then you want to make sure that you don't share any of your washcloths or towels with your family members. And if any of your family members are showing the same symptoms of conjunctivitis that you have, just let the provider know. Also, if you have any redness, swelling, or burning, or if it's getting worse, just you have to call a provider.
Okay.
Okay. So we went through the steps. So in your own words, can you just reinstate what I said, just so I could know that you have a better understanding of how to administer this medication?
Yeah, so before I put it on, I wash my hands and my face, and then I take the tube, and I take it out, and I keep the cover on the side, and then with my left hand, I pull down my eyelid, and then I put it to about halfway, I twist it, and then I close slowly, and it's gonna maybe a little blurry, and then I just put it in. And how many times do you want me to do this?
So your doctor is saying 6 times as needed.
Okay.
Okay, so whenever you feel burning or like if it hurts you, then you just apply that on there.
Okay.
Okay, and also I forgot to mention, you always want to keep the tip of the applicator sterile. So you don't want to put your hand on top of it or like in your eye.
Okay.
You just want to keep it far away enough that it's away from your eye, but also placing it in the conjunctival sac.
Okay.
Okay. So do you have any questions?
No, this is good.
Okay. And do you want me to write down these steps for you?
Oh, okay, that would be useful.
Yeah. So I'll print that out for you, and I'll let the provider know, and then you'll be ready for discharge.
Okay. Thank you, nurse.
Okay, you're welcome.
Alright, and we're back here. So the client did an excellent job safely administering his eye ointment of erythromycin, and reflecting on the teaching method and outcomes, the client clearly understood the medication. The client was able to effectively place an eye ointment using medical asepsis, and was able to teach back the learned procedure and was very confident. The eye ointment appeared to help the conjunctivitis. The client was informed when to call the provider when the condition worsens or had no improvement. Thank you so much for watching this video today. I hope this helps you teach your clients as well how to use eye ointment. Thank you so much. Have a great one.